their management. So today we'll questions about ECG interpretation, just simply ECG interpretation, so you understand what is common procedure like heart block, AF, facial calculations. Okay, and of course you will given some scenarios. You will be given some scenarios where the rhythm play will give you a ECG script where vital signs like BP, SpO2, and you have to the questions about the management about these patients' condition, like whether the patient is suffering from arrhythmia with shock. So therefore, like if the patient is suffering from fast AF with shock, probably you have to compare what cardioversion and what we have discussed in the tutorial 2. You'll given some scenarios with the ECG strip with the BP patient's condition, and if you think about that, you have to answer which of the following how to use the defibrillator and save the patient's life. And of course, we have some questions about co-management. So make sure you have good understanding of the rationale principle of co-management. So for ECG, it's a very I'm not going to repeat, but just very quickly about you want to have good understanding of ECG, you have to understand the normal durations of like PR interval, what's the meaning of ST segment elevation or impressions. So sometimes we will give you the ECG strip and then you have to identify whether your patients have heart block and which kind of heart block. So therefore you have to understand how to calculate the duration of QRS or duration of the PR interval. And so, of course, and make sure you understand how to do the calculation. Like in our last tutorial, the second tutorial, we'll have some questions about calculate the ECG rhythm by calculate the square between the RR. So make sure you understand how to do it. And the rationale is what the 6-step method. And what is 1,500 method and what's 300 method? Because I found some students you get wrong in the quiz 2 about how to calculate the heart rate by calculate the square between the RR. And of course, we in this course we have discussed the atrial tachycardia, atrial fibrillations, and atrial flutter. Atrial flutter. Remember for ECG. The normal sinus rhythm, normal rhythm, is from S0 to A0 and then down to 1 beats. However, your patients sometimes will have ectopic, okay? Because if your patient has some structural changes within the heart, or if your patient has some hypoxia, electrical imbalance, your patient's myocardial cells will generate the impulse. We call it ectopic atrial flutter. And if this ectopic can transmit to the AV of your patient, you will have atrial tachycardia, atrial fibrillations, or even atrial flutters. And our concern is how the AF or the fast rhythm affect the BP. Do you still remember why your patient suffering from tachycardia, your patient will develop shock? 點解如果我哋好擔心佢有 tachycardia，佢哋160幾、180幾，佢哋點解會 shock 㗎？Reduce in ventricular volume because the time for the birth from atrium to the ventricle will decrease if your patient has fast heartbeats up to 100 more than 160. So your patient probably will develop hypotension because of persistent tachycardia. So make sure you understand the characteristic of atrial flutters. What is atrial flutters? Probably your patient have a recurrent circuits within the atrium, and your patient have flutter rate. And atrial flutter, you will find the patient flutter rate before the And for patient with AF, probably your patient will have multiple foci within the atrium. And these multiple fire will randomly transmit to the AV lobe, and therefore your patient will record some narrow compressed QRS because they're different from the atrium. But because the fibrillation within the atrium, we will record the fibrillation wave before the QRS. So the characteristic of the AF is A, narrow compressed, irregular, and fibrillary waves before the QRS. So for patients with atrial fibrillations, remember our concern is about the rate. 如果你收 PK 個 patient 有 AF 咧，我哋第一個 concern 咧係個 patient heart rate。If the patient heart rate is around within 100, probably your patient's blood pressure will not be affected. However, if your patient suffering from AF with the rate more than 160, probably your patient will develop hypotension shortly. And remember what is atrial ventricular block. Okay, there are three types of block: first degree heart block, second degree heart block, and third degree heart block. Make sure you understand how to calculate by measure the first degree PR interval. The first degree heart block characteristic is regular rhythm with prolonged PR interval. The PR interval will be more than 5 small square. And for second degree heart block, you will find your patient with lengthening PR interval and then drop it. So we will call it second degree heart block, will be type 1. And the second degree heart block type 2 is you find your patient have regular PR interval with drop beats. And this will be type 2. And then for third degree heart block, you have to, like in what we have learned in the tutorial too, when you measure the PR interval, you try to identify the R first, and then before the R, you try to recognize it as a T wave, and then you will find some similar shape that will identify it as a T wave, and then you will find the T wave is regular T wave and regular R rate, and the PR interval do not have a very strong relationship like this when it's lengthening or constant, and then you will find that it is a first degree heart block. So what should you do if you find your patient have heart block? The first, you already identified your patient have heart block, usually now. Then, pacing. Before pacing.
Pulse monitor.
Check BP, in those given scenario, whatever your patient 係有咩 dysrhythmia， 第一樣嘢係 measure 咗個 BP 先去inform 個醫生點啦。因為其實淨係個 rhythm 有時候有啲佢有時就算佢係 second degree heart block 嘅時候，個 BP 可能係都係within 一個 normal range 嘅。OK， 咁所以咧，同係個 patient 有dysrhythmia 第一個 reaction 咧係要 check 個 BP OK，check BP。And then see whether your patient is stable or not. Is it clear? 出咗 BP， 跟住當然頭先同我講得啱啦。如果個 third degree heart block 如果個 list action 有機會個 patient become unstable， 佢係如果係個bradycardia 嘅話，我哋會準備係pacing 啦。And then ventricular dysrhythmia, we hope we learn is ventricular tachycardia and VF. Remember, VT can be stable. So the first action, if you find your patient have VT, you have to palpate the pulse. 邊個 pulse 最容易摸啊？邊個 carotid pulse is very good。如果你 patient 真係有 VT 嘅話咧，通常喺醫院度做 overdose 啦會嗰啲 patient 會容易啲，會有機會係人醒嘅，但係會出咗 VT 出嚟嘅。咁咧，你請你嘅一樣嘢摸一摸佢嗰個 carotid pulse 可能係有 pulse 嘅。Okay, we call it stable VT or unstable VT, which is pulseless. 好，如果個 patient 係 pulseless VT， 你要做啲咩啊 ？pulseless VT， what is the first action 啊？
Shock.
係咪啊？要 initiate CPR 準備 defibrillation， 所以 make sure 睇清楚佢題目，睇清楚佢題目，諗清楚個 situation 你應該做啲咩。如果你 patient 係我覺得 VT repose， 你要係 check 個 VT repose 咁你可以係，如果你發現個 reason 第一個發現佢應該有呢個 reason 係，咁你用我去 pulse 啦，如果你有 pulse 你可以 check 下 BP， 跟住先健康醫生啦。如果你 vision 有呢個 vision， 而你攞咗冇 pulse 嘅，其實你要 call 個 pulse， 你要 call management 咁咧就係準備你哋嘅 CPR 啊，準備嗰個 defibrillation， 呢個清唔清楚？And then ventricular fibrillations 啊，如果見到呢個 rhythm， 你要做啲咩啊
？Check pulse。
我哋可以 initiate CPR 啦，可以 initiate CPR。And algorithm for dysrhythmia， 呢個咧喺你哋個 PowerPoint 裏邊都有嘅。咁你哋咧就 push 你哋有個 ideas 啦嚇。如果你因為佢
我開頭話 CPR， 跟住後尾
即係個 patient 嘅話咧，你係有時係都會 ECG 係快啦，有時可能你都唔好 sure 究竟係AF 啦，或AT 咁樣，需要其他嘅。咁我哋咧就快啦嚇，因為多過一個人其實有機會嗰個佢會比較 hypertension because of 嗰個。So make sure you understand the nursing care when you care patient will take this treatment. Make sure you check the patient's airway, SpO2 and pulmonary oxygen. If the patient has correct the patient to calm down. Or BP.
CPR
This is a very basic.
但已經有嗰個心電圖出咗嚟咯。
希望你哋唔好寫單詞啦，即係要你寫 nursing action， 但係就會成日寫 BP 即係寫呢啲冇咗 rationale 後邊啦。咁其實你都可以想象到你唔攞 full mark 個 question， 所以咧請你寫清楚maintain patient airway 啊 correct calm on to identify rhythm， 好似我 correct patient to calm on 呢啲有前冇後嗰啲答案咧，其實你明明可以攞咗分，你就攞咗半分。呢啲答案請你哋寫得好啲，寫下條線。以往我哋改卷嘅時候，有時候就差嗰半分俾唔到你啦。OK correct。有啲同學就會答 correct to calm on， 咁後邊嗰個 identify rhythm 冇寫到，咁你唔可 assume 嗰陣時俾埋半分嚟，係咪？咁其實啲同學可以寫得好 detail 或者好 demonstrate， 好 understand how to care the patient， 嗰個咧淨係講咗半句，半句諗住我幫你寫埋佢咁啦嚇。咁我嗰啲你就攞半分啦，你唔識嘅都唔知㗎。So probably you have to monitor the patient's vital signs, connect the patient to calm on to identify the rhythm, and check whether your patient has hypotension, altered in the mental status, any sign symptom of shock, any ischemic changes, and your patient complete chest discomfort or sign symptom of heart failure. If yes, in a tachydyspnea, we can prepare synchronized cardioversion. Okay, make sure you understand. For a fast tachydyspnea, we have to prepare synchronized cardioversion. If no, your patient's quite stable at that moment, we have to check the QRS, the duration of QRS. 一般嚟講，喺考試度咧，你就需要記住 narrow compress 同 wide compress 嘅啫。有時候唔會有啲問題問你嗰度係一格半定係兩格嘅。總之我哋籠統啲唔多過三格嚇，唔多過三格咧就係atrial 嘅 rhythm 啦，多過三格咧係一個 ventricular rhythm 就 OK 㗎啦。唔會喺度執著究竟嗰度叫做一格半啦，定叫做兩格。咁所以呢個你哋總之要你知道 QRS 嘅atrial 其他嘢咧就係 QRS 少過三格啦 ，QRS 係大過三格就係 ventricular。If no, this is a ventricular rhythm. The QRS is less than 3 small square 少過三小格，咁咧我哋and then you make sure you have your patient have IV access and do traveling ECG for the patient for further rhythm identifications. Probably the doctor will start with vagal maneuver, like ask the patient to take a deep breath and hold, or do the thoracic massage, or they will try to adenosine if this is a regular narrow compress, or some doctor will prescribe beta blocker and calcium channel blocker for infusions. So what's your nursing care if your patient patient have calcium channel blocker infusion. What's your nursing care? 如果你 patient 已經吊住嗰啲medication for dysrhythmia，吊咗藥，或者醫生而家吊緊藥啦，有咩 nursing care 啊？ Monitor patient's BP and ECG rhythm, especially the IV calcium channel blocker. Sometimes some patient will react very dramatically 可能你未寫個版咧，再聽 BP patient 咧已經係有啲drop 咗嘅，因為佢係有 vasodilatation effect and also calcium channel blocker 可以 delay 個 AV conversion。有啲 patient 咧，如果你吊咗 IV 咧，佢可以係好快就變咗慢咗啊，咁跟住就。會有啲 hypotension， so that's why 如果 patient on the IV 嘅或者beta blocker or calcium channel blocker or any IV cardiovascular medication which can cause vasodilatation, decrease the AV conversion, you have to measure the BP, measure the ECG, check the ECG rhythm. And if your patient has one complex tachycardia, probably we call it this ventricular rhythm, and then we have to, again, similarly, the doctor can give adenosine or considers other medication infusions like calcium channel blocker and consult CCU to offer it. And if your patient has bradycardia, again, especially if the rate is less than 50, make sure you check the patient's SpO2, and the patient has patent airway, and you have to correct the patient to come on, make sure there's to check whether your patient has heart block or not, or just a very simple normal size bradycardia, or if your patient has heart block, and measure the blood pressure. And make sure your patient has IV access because your patient may have to receive some medications for these bradycardias. And do the check the ECG for further ECG interpretations. And if your patient do not suffering from any hypertension, immune syndrome, you can monitor and keep observe. However, if your patient have some hypertension or some symptom of shock, probably the doctor can start with some medication like atropine. Atropine can for the patient. If your patient just have a simple bradycardia, so atropine can help to increase the heart rate. Dopamine and adrenaline is for hypotension. Okay, if your patient suffers from hypotension because of this bradycardia, probably dopamine and adrenaline can help your patients. And or you the doctor may order pacing or this really dysrhythmia. So for the treatment for dysrhythmia, we have learned several things like Rego maneuver, and here I just highlight some. For Rego maneuver, of course, you can ask the patient to have coughing, gagging 即係叫佢反胃，即係你擺支 calm depressor 佢反胃佢咁樣都得嘅。或者 bearing down 嘅。And then carotid massage. Carotid massage is by doctor or nurse. But before you do the carotid massage, make sure you use the stethoscope to check your patient's there's no worry. And you massage 入邊，如果你 massage 兩邊嘅話咧， you will reinterrupt the blood to the brain. Okay? And also, if you do not check the carotid artery before the massage, you may dislodge the pump to the brain and cause the patient have ischemic stroke. And some medication, I hope you have a very clear idea because amiodarone is a very common medication that we will provide to the patient if the patient is suffering from dysrhythmia and even during the resuscitation. So therefore, we have good understanding of what amiodarone. And amiodarone is only compatible in E5. In hospital, the common incident patient will receive the best effective medications. And adenosine 記唔記得 adenosine 嘅故仔啊？adenosine 邊個打㗎？
醫生打，
點解要醫生打？
危險。
佢因為咧打adenosine咧，佢打完之後咧，個 patient 有 description 啦，佢打完之後咧會有一個 transient pause 嘅通常係 expected 嘅，跟住佢慢慢啲，佢再呢個 pause 翻嚟咧會慢翻啲嘅。咁有時候呢個可以係講緊幾秒啦，有時候可能唔去到10秒咁樣。咁所以 that's why 打呢隻藥咧，佢要係有each body standby 啦，each body 床邊啦。咁亦都係如果你喺病房度冇醫生嘅，咁其實你如果佢 pause 咗好翻到嚟咁嘅話，咁其實即係佢 arrest 咗。所以 that's why 呢隻藥咧就一定係醫生打嘅，就唔好話醫生話個 patient 而家有active dyspnea 啊，要封verbal order 打電話verbal order 先我都上緊嚟，咁打咗之後其實佢萬一真係個 pause 好長或者變 arrest 咗嘅話，其實就幫唔幫到個 patient。So that's why you have to understand the consequence of this medication after this medication injection. And of course, if your patient suffering from recurrent SVT, we will do the BPS for the patients to identify which area the patient have a very active motor, that your patient always have an active atopic from that area. We can use the energy probably we will use the heat pulse or sometimes we will use the cryotherapy to destroy the active atopic over the atrium or over the ventricles, so that to prevent your patient have very frequent SVT or AF that may make your patient's hypotension frequently. And remember, what's the difference between cardioversion and defibrillation? 有咩分別啊？兩樣嘢有咩分別啊？
prevent our
synchronize
同 synchronize 啦嚇，呢部機咧記住喺醫院度咧，其實可以做 pacing 啦，佢個名叫 defibrillator， 但係其實可以做 defibrillations、cardioversions 同埋呢個pacing 嘅。咁呢個 gel pad 有咩用啊？呢個 gel pad 唔俾個 pad 就好點得啦。
好痛。
第一就係會 burn 咗啲 skin 啦，係咪 burn 咗 skin 啦？如果你冇咗呢個 pad，你就放電落去。第二就係冇咗啲 gel 嘅話咧，嗰個transmission of energy 其實都係有影響。你除咗 burn 咗 skin，你啲 energy 都係 transmit to 嗰個心嘅。所以 that's why 記得俾翻個 gel pad 啦嚇，位置啦嚇。咁呢個係如果係defibrillation， we can use this pad for defibrillation, or we can use this multiple functional pad for the patients. 記得真係要 make sure 你哋係知道咩係 synchronized synchronized 啦，咩幾時做 cardioversion 啦 defibrillations 啦因為講做嘅時候即係有時候有個人喺床頭整緊嘢，咁床另外嗰邊喺 uterus 上面整緊嘢，咁其實真係有個人影少粒掣咧，佢撳 shock 咧，其實係好大分別嘅。咁所以咧make sure 你大家有個 good communication 同埋 understand 個 patient 需要啲乜嘢，當時發生咗咩事。如果 patient 本身咁做 cardioversion， 就因為冇撳過 synchronized 嗰個掣咧，就變咗 defib 個 patient 啦。咁本來可以幫到 patient， 變咗 patient 變咗更加差添。So nursing care for patient with cardioversion, always get your emergency equipment啦, explain the procedure. Today we have did the sedation before the procedures and work on the patient's baseline cardioversion, so they understand why your patient has to do cardioversion. And ensure that there's a synchronized mode. The our way is recognized. 如果你撳咗 synchronized 咧，你一定會見到嗰個 our way 㗎。如果冇嘅話咧，你要 care 自己冇撳咗兩下之後，佢變咗冇咗嗰個掣嘅。有啲係零嘅，有啲係撳嘅。咁你 make sure 你 check 清楚，你撳咗 synchronized 之後，個 monitor 有 synchronized 啦，係咪 identify 到 our way 咯 ？And then correct the defib pack to the correct locations. The energy normally is prescribed by doctors because it's a cardioversion. Some doctors will like to start with some low energy. Okay, so please make sure you understand the doctor's prescriptions. we have to monitor the cardio rhythms and vital signs。有時見一次咧，咁條 strip 會睇一睇我哋會佢，咁啊跟住我哋會睇佢會唔會慢翻啲啦嚇，要睇上醫生電一次定電兩次啦。如果跟住最中間要 monitor 翻個 PT 嘅。And because your patient have received the sedation, you have to check whether your patient have developed any complication because of this sedation. Your patient有咩complication of this sedation 㗎？嗱 sedation patient 我叫有咩 complication 㗎 ？respiratory 問題啦，口氣啦，so that's why you have to observe whether your patient have developed any symptom of complication of this from the sedation like the increase in the respiratory effort. And after the cardioversion for tactic dyspnea, the doctor sometimes will prescribe some anti-dyspnea agent for your patient. So and then for the defibrillations, we only do the defibrillations for pulses with PF. Okay, and electrical activity PA 咧，我哋講 PA 做啲咩啊 ？assist 你做咩電㗎？
唔使。
唔使 assist 你唔使電啦嚇，因為 defibrillation 咧原意係因為個 patient 咧喺 pulse SVT 同 BF 入邊咧，其實佢有少少嗰個
有少少希望先電，希望
嘅 activity 喺個心度啦，好似呢啲咁樣，仲有少少呢啲 electrical activity 喺心度，所以做個 defibrillation 咧係可以重新再同佢做一次depolarization 啦 polarization and then depolarization 咁啊，希望個 and then after 呢個 cycle 之後咧，個 SA low positive control and generate 個 habit 嘅，咁所以 that's why 我哋只係會同VF 或者話 pulse SVT 嘅 patient 咧做 defibrillations 嘅。咁如果你 patient 即係 asystole 咧 asystole 即係嗰度係冇 electrical activity， 所以你做嘅 defibrillation 就係幫唔到頭先我講嗰個depolarization 啦 polarization and depolarization that's why 佢哋就唔會做defibrillation in 嗰個asystole 嘅。So make sure you understand the protocol. So and then is so the safety alert is the defibrillation and cardioversion 呢個都成日做嘅，同埋都上咗新聞啦，所以 that's why 真係搞清楚你係每個 patient 需要 defib 啦定 cardioversion 調翻轉頭，如果你 patient 需要defib 但係你咧個 synchronous button on 咗咧，其實都幫唔到 patient。And then indication for cardiac pacing bradycardia with symptomatic means hypotension or your patient has a severe sinus arrest, move type 2 second degree heart block, complete heart block. And overdrive pacing is not overdrive pacing 唔係你哋呢個感受嘅，呢個唔需要嘅。咁總之係個 cardiac pacing 咧係個 bradycardia 慢嘅，而人嘅 hypotension 咧我哋就會做 pacing 俾你 patient 嘅。咁nursing care for patient with pacing 啦都要識嘅，因為咧尤其是你哋有時將來病房度咧，你會第一樣嘢 identify 咩係 pacing design， 其實呢個 pacing design 可以係apply 如果你 patient 嘅 pacemaker 咧已經裝咗 pacemaker， 而係佢即係如果你 heartbeat 係非常靠個 rely on 嗰個 pacemaker 去 generate 出嚟嘅話咧，你喺 ECG 度咧會見到 pacing spike 嘅，咁你就知道其實個 patient 都 heavily rely on the pacemaker 去 generate 嗰個impulse 嘅。咁and then for when you take care patient with transcutaneous pacing， 要睇翻啦嚇，咁有幾個situation 咧，個 patient 可能係好似裝咗 pacing， 但係其實個 pacing 係唔 work 嘅。例如咧，你會見到我哋最理想咧就係一個 pacing spike 即係一個 pacing spike 放咗電出嚟之後咧，可以 capture 有 QRS， 即係所以 generate 咗個 capture 咗之後有個 QRS 嘅 depolarization， 所以應該一個 capture 入邊咧有個 QRS， 一個 capture 入邊咧有個 QRS 咧係最 ideal 嘅。咁但係好似呢個 case 咧，我哋叫 failure to capture because we can see the pacing spike， 即係個心咧 capture 唔到啦，所以咧就冇 QRS 嘅。咁所以呢個就唔理想啦。咁我哋會 failure to capture， 醫生睇一睇啦，究竟係咪需要將個電可能再搞翻大少少啊？ And then failure to sense 咧就係有時候個 patient 本身自己都有啲most of the time 都係地方個 係話佢其實 patient 自己都有 regular 嘅 QRS regular first，但佢都係會整 fire 出嚟咧，譬如完全 sense 到個 patient 有自己嗰個 spontaneous heartbeat 嘅話咧，佢都照 fire 嘅話咧，有機會如果呢個電咧係按咗個 peak of hour 嘅話咧，個 patient 咧都係會有R on T phenomenon 嘅，記唔記得咩係 R on T phenomenon 啊？即係話其實 R on T 其實去 R 因為 peak of hour 嘅話，呢個位咧其實個心咧已經係開始做緊 repolarization。但係如果佢喺呢個位電到佢嘅話咧，其實佢會有機會咧係令到佢，因為佢已經準備做 repolarization，但係呢個位佢電咗佢嘅話咧，其實佢係會有機會又重新再做一次 repolarization，但係因為嗰個 energy 咧唔夠做一個repolarization，佢就變咗 VF 啦，咁變咗就呢個都係一個 dangerous 嘅 condition。And then failure to pace. You find that there's a pause, okay, a long pause between the R is absence from the pacing spike, like the gap between two RS, and we call it failure to pace. Probably your patients have blood pressure will be affected. And then this is just a summary. Make sure you understand what's the management of dyspnea. If your patient has brachial dyspnea, we start with some atrial and we use pacing. Or tachycardia dyspnea, we start with some SVT or using AF with another or we use a cardio version of the pacing patient. And then for child ECG interpretation in this course, of course you have to remember 呢啲咧係要記住咧個 locations of the lead 係代表邊條血管嘅。你咪睇 ECG 其實 ST elevation 咧唔難睇啦，係咪？如果佢一係有嘢嘅時候咧，係你會睇成 ST segment 上咗去。咁你係你要我哋你 as a nurse 咧，你要知道邊一失咗邊一 part 嘅 ST elevation 代表邊一 part of the heart。譬如係23呢啲就係呢個。rear part of the heart 啦anterior 就係 V3、V4 lateral 就係 V5、V6咁或者頭先同你要記住佢邊條血管塞咗啦，咁呢個係 for 你個 ideas 點樣去 report 同埋你會睇到個 patient 究竟左邊心有事咧定右邊心有事嘅，即係rear part more around the right part of the heart，OK？ 咁lateral part of the heart 或者 anterior 就會係比較係左邊心嘅。咁所以咧一定要記住，如果唔係咧，你識睇 ECG 你識 identify ST elevations， 但係你咧就唔知道你個 patient 咧係邊條血管塞咗，或者邊一 part of the heart 係有問題。And 嗰個 ECG evolutions during acute ST-MI 啦咁如果你 patient 開始有 hypoxia 嘅話咧，其實佢係會 start with some ST elevation 嘅其實你都 start with some tall tall T's first 咁跟住其實之後咧佢會開始有 ST elevation 啦 decrease our weight 啦，同開始有啲中有 necrosis 發生嘅時候咧，記得咧點解有啲 Q wave 點樣嚟㗎？Q wave 係一個 necrosis tissue absence from 呢個 electrical activities， 咁 that's why 佢哋就會係 project 到對面呢嗰個 wave 方令到佢 generate 咗 Q wave。咁所以如果佢開始有 necrosis tissue 嘅時候咧，你個 patient 會開始有 Q wave 嘅。咁跟住咧佢會Q wave 嘅越嚟越深啦，有個 necrosis tissue 係高咗。咁跟住開始有 T wave inverted 啦咁 T wave inverted 就係嗰個 ischemic changes 咁慢慢隔幾日之後咧，其實佢 ST 咧就會 within 翻個 normal range 嘅會翻到 within 個 normal range。跟住咧，但係咧個 T wave 有啲 inverted， 因為個 ischemic changes within 個 myocardial tissues。咁到慢慢隔咗一個禮拜度咧，幾個禮拜度咧，其實你會發現咧個 patient ECG 咧就會係 ST segment 嘅 T wave 咧會翻翻 normal 嘅，但係咧就會有 persistent 嘅Q wave， 呢個 Q wave 咧唔會係 disappear， 即係唔會冇咗㗎啦，因為佢係有個 necrosis tissue， 咁佢嗰個就會令到我哋咧 record 嗰個 Q wave 出嚟嘅。所以如果你見到 patient 啲 Q wave 嘅話咧，你可能睇一睇 patient 會 congenital chest pain 啦跟住佢係會有pathological history， 其實話佢又係有OA 都有講angina 係咪 angina 即係心絞痛？咁一般嚟講，非常個血管塞咗幾多 percent 先開始有心絞痛啊？咩係 stable angina？ What is stable angina？
Rest no pain。
有啲人用做 exercise predictable 嘅，即係突然之間或者突然間跑步啊、行樓梯啊，嗰個 exercise tolerance、exercise 嗰個 increase 咗嘅時候咧，佢開始有心口痛。exercise oxygen demand 多啲嘅時候咧，會心口痛。咁嗰啲我哋叫，但係呢個 predictable 嘅，休息就冇事嘅。我哋叫 stable angina， 一般嚟講70%你全部block 咗70至75%左右，你個 patient 已經開始會有 stable angina 㗎啦。咁但係因為呢個係 predictable 啦，所以會 stable 啦。咁如果你個 patient 咧80% 咗啦如果我哋講緊你個 patient 咧係有STEMI 咧，其實講緊嗰個 moment 咧，佢係差唔多99%甚至乎100% block 咗嗰個血管嘅，所以 that's why 係冇 burst supply to the myocardium tissue， 所以 STEMI 咧係一個 emergency 嚟嘅，清楚啊？咁 non-STEMI 咧可能講緊90幾啦即係個 patient 都會 complain chest pain，都得閒嚟到做 ECG， 可能 ST segment 係ST depression 嘅，咁 non-STEMI 可能佢係90%啦。咁但係講緊 STEMI 講緊其實係差唔多係差唔多100%、99%，咁所以咧佢impair 咗 burst supply to 嗰個 myocardium tissue。咁咧喺呢個 cause 度咧，其實咧有一樣嘢咧，你哋要 understand 咧就係有時你睇書咧 myocardium injury 啦、myocardium ischemia 啦係唔一樣嘅 ，OK？myocardium injury 咧係講緊 ST elevation 係嚴重啲嘅。myocardium ischemia 咧，即係可能係你見到嘅 inverted T ST depression 咁其實有時係 oxygenation 做個 myocardium 唔夠，有時候你 improve 咗個 oxygen 咧就會好翻啲嘅。咁所以咧喺 ST elevation 嚟講咧，我哋咧通常用個唔係通常喺啲病講到啦，我哋交間溝通啦 myocardium。我哋會 induction 啦 ，myocardium injury 啦。如果你 patient 有 ST elevation 咧，我哋 refer 做叫做 myocardium injury 嘅 ，OK。但係如果你講緊 myocardium ischemia 咧，其實講緊係 inverted T ST depression， 其實嗰個程度咧就未去到 in 頭先嗰個即係講嘅 ST elevation injury 咁高。injury 係講緊係已經開始有你想象到，如果你 patient 已經有90%、99%失咗咧，開始 burst supply 住個 myocardium 嗰個咧，遲多1、2個鐘咧。旁邊嘅 tissue 咧已經變咗係 close， 咁呢啲係一個 irreversible 嘅 changes 嚟嘅，所以 that's why ST elevation 係 refer to myocardial injury is more emergency， 知唔知啊？即係所以個字眼理解上好似差唔多，其實佢哋唔係共通嘅。喺我哋臨床嚟講咧，myocardial injury 咧係 emergency 係再緊急啲嘅，因為 refer to 有啲 myocardial 嘅 process within 2 hours。And then 咁啊，mobility therapy 咧係唔使要俾 ST